All right, we'll go ahead and get started. Thank you all for being here for the COVID-19 Washoe County media briefing. We'll have Kevin Dick, the District Health Officer for the Washoe County Health District, on today. If you have questions and don't want to say them, you can put them in the chat. And this meeting is being recorded. So Kevin, if you're ready to go, please go ahead.
Yes, thank you, Scott, and thanks everybody for joining us today. It's very important that you're here and can help us in to communicate to the public the situation that we have with the COVID-19 outbreak that's occurring here in Washoe County. We are continuing to see increases in new cases. So we're at really the height of where we've been as far as disease transmission in Washoe County since the beginning of the pandemic. To give you a feel for what we've seen with the increase in our number of cases, back on September 15th, our 7-day moving average was about 57 new cases per day. And as of yesterday, our 7-day moving average was 158 approximately new cases per day. So that's a huge increase that we've seen in a short period of time. We've been seeing 25% increases per week over the last few weeks of new cases. And so as a result, we now have over 2,000 active cases of COVID-19 in Washoe County. And what we're seeing is not that this is all coming out of particular hotspots and outbreaks that are occurring, but that we have widespread community transmission. And that's why I've urged people to exercise extreme caution with being out and about, because we know that COVID spreads when infected people come in contact with people that aren't yet infected and infect them. So the more that we're out and about and having contact with additional people, the more we increase the risk of possible transmission. And I know there are people that have contracted COVID-19 thinking that they were making responsible decisions about getting together with a couple of friends, perhaps for a dinner, thinking that they've been careful, we've been careful, we should be okay, and then find out later that one of the friends is tested positive, and they were having dinner during the infectious period. And so we need to recognize that we're not out of the woods with this COVID-19 pandemic. In fact, we're right in the midst of highest levels of widespread community transmission that we've seen to date. And the best recommendation is to try to remain with your immediate household members as much as possible, and to limit other places that you go. Of course, people need to work, and we want those workplaces to be open. So that's a necessary thing for people to go to work. We know people need to buy groceries, et cetera, but to try to limit the exposure that you have to others to those essential activities, and to remain at home and with your immediate household members when possible, or be outdoors with your immediate household members, enjoying the beautiful weather that we have coming up, and the beautiful outdoor environment that we have here in Washoe County. With that said, I wanted to also talk about Halloween and Dia de los Muertos coming up here. And as you recall, we've recommended against trick-or-treating this year because of those additional encounters and people that you come across and the potential for disease transmission. I did read a really good quote in the Reno or the Gazette Journal yesterday.
Go on.
Let's go.
If we could please have people mute if you're not actually talking. Thanks. So I had read a real good quote. I believe it was from Dr. Ariel in the Reno Gazette yesterday. Said your life and the well-being of you and your children aren't worth a bag of candy. And I think that's really something important for everybody to be considering as we're making decisions about these holidays or celebrations coming up. And please celebrate responsibly. We have Nevada Day also coming up on Friday, and sort of that Nevada Day holiday over the weekend. Again, recommend against gatherings. Recommend that you do stay with your immediate households to limit potential contacts with other people that may be infectious. And as I said, it's supposed to be really good weather. So we have great opportunities here in this region for getting outdoors, staying separated from others that aren't part of your immediate household, and enjoying our beautiful outdoor recreation opportunities and parks, et cetera, that we have here in Washoe County. So just a note on the hospital beds. The Hospital Association has now provided us with the statistics on staffed hospital beds in addition to licensed hospital beds. So I appreciate that they're providing that information now. And so we did know that we were getting close to capacity on several occasions with ICU beds here regionally. So those statistics now are 82% of staffed hospital beds occupied. I think that gives us a realistic picture of where we're at versus staffing, and 68% of licensed hospital beds that are occupied. And I do know that we do have hospitals that are working on increasing their staffing so they'll have more available staff beds as well. So with that, I'll open it up to any questions.
Hey, Kevin, it's Kenzie with News 4. We're seeing places like Renown and CVS who are turning test results around almost immediately. We had someone get tested and the results came back within 24 hours. And then we're seeing places like UNR who are seeing anywhere from a 7 to 9 day delay. Can you link anything, and why is there such a discrepancy there?
Well, the UNR is the Nevada State Public Health Lab, and they are doing the testing for counties across the state, with the exception of Clark County. They also do testing of all state correctional facilities. They're doing testing for skilled nursing facilities, et cetera. And so what we've seen is that they have had a high number of tests that have been sent to them to be analyzed. And so they only have so much throughput, and that's created a backlog for them. Renown does have the 24-hour turnaround. However, they're managing the throughput that they have for that to be able to preserve those turnaround times for their results in order to have that speed with the results. Of course, if we had more lab capacity, that would help us with getting quicker turnaround times. That's why we're working with Charles River Labs to try to utilize the capacity that they have, so that we don't have to be sending our tests to the State Public Health Lab every day that we're running the post.
And what's your testing delay at the lab look like right now?
At the state lab?
Correct.
I couldn't tell you what it is today, but I know that we have had those delays that have occurred as they've gotten backlogged.
Hi, Kevin. It's Siobhan from the RGJ. How are you feeling about just schools in general, the Washoe County School District? And are any cases of kids who have it at school, have any of those been linked to someone else getting it at school, or is it still all just community spread, nothing happening student to student or student to teacher at school?
Yeah, thanks, Siobhan. I think for the most part, what we're seeing in the schools is a reflection of what we're seeing in the community, where we have widespread community transmission. And so, we want to keep the schools open. We want to keep our businesses open. And I know that school is actively messaging, the schools are actively messaging, and I am as well, that if we want those things, then we need for everybody to take appropriate precautions and limit their interactions that aren't necessary for them that might lead to spread of disease. So I think the school has done a very good job with the plans they put together, with the social distancing and the mask wearing, et cetera. But it's very important for families as well as their staff to maintain those precautions outside of school so that they're not getting exposed elsewhere and then bringing it into the schools because of that community transmission. We don't have outbreaks that we've identified as being epi-linked to a teacher coming in and spreading it to the kids or to the kids spreading it. But it's difficult to do that sometimes with a lot of transmission and not everybody getting tested. So we do have some classrooms where we have COVID-like illness outbreaks that we've identified, but we don't have the students their parents haven't had them tested perhaps, and so we don't have any confirmatory test results. But we do see some classrooms where we have a number of children that are out of the same classroom with COVID-like illness occurring.
I know, like at Rollin Melton, you have kind of all the kindergarten students out. Do you have other schools where it's widespread like that, where you have just massive amounts of students out in classrooms?
I think we have a number of classrooms that where we have about 20%, not all of them out of a classroom, but 20% of the kids that are out with COVID-like illness symptoms. We have influenza-like illness outbreaks that typically occur in schools that happens every year. And I think everybody knows how similar the COVID symptoms are to the flu symptoms. So it's not surprising that we have some of these COVID-like illness classrooms.
So 20% are out with symptoms, but then you might exclude the entire class?
That would be heightened monitoring of that class. We don't automatically exclude the entire class at that level. We did have to have the Gerlach school closed for 14 days. They had cases that were occurring. They have only 2 classrooms there. And between the exposure in the classroom and the kids riding the school bus there, there was enough close contact that we made the decision to work with them to close for 14 days.
So like at Rollin Melton, the entire kindergarten class, all the students aren't excluded? That's what I just heard from a teacher. Is that not something you've done?
I don't believe I've been briefed on that,
Okay.
but I can have Scott look into that and get back to you.
Thanks.
Hi, Kevin. It's Kenzie again. I know you guys are holding an emergency meeting tomorrow with the state's COVID task force. What's going to be your recommendation tomorrow?
Well, Kenzie, we're currently working on that with our regional partners. So I think it's premature for me to comment on that now. We've got some additional meetings happening before the task force. So we'll be having that discussion, and you'll hear that during the meeting tomorrow at 1.
Hi, this is Siobhan again. How's contact tracing going with the school district? They mentioned it last night at their school board meeting and said they're asking for more help from your office. Can you provide that? And do you not have enough people to deal with a lot of the pediatric cases?
We do have a strike force of individuals on each of our EPI teams that are jumping on the pediatric cases when they come in and doing the disease investigations. So we are getting those turned around quickly. The lab results come into the evening, and so we may not have everything done by the beginning of the next school day, but I don't know that additional contact tracers are going to solve that problem for us. We have to get in touch with the parents. We have to get in touch with each of the teachers that the children attended class with. So if you're in middle or high school, it could be a number of teachers that we have to interview to identify potential close contacts in those classrooms. So we're jumping on those. Those are being expedited, and we're working them as quickly as we can. So we're not falling behind on the pediatric cases.
Hey, Kevin, Scott Sauner at Associated Press. I know you've talked before about COVID fatigue and that there's no real specific hot spots and that it's generally being spread. But these numbers are so dramatic as of late. Are there any other factors, any scenarios you could contemplate? Is the virus itself becoming stronger? Is the weather at play? Are there any other factors that might be, an aiding or abetting factor?
Thank you, Scott. What we have seen, I think, is not unusual as far as what other communities across the country has seen. And that is beginning in August, we had a significant increase that began of cases that were occurring in the 20 to 29-year-old age range. And we also at that point were seeing a pretty good increase in the 10 to 19-year-old age range. That's kind of leveled off a little bit more than the 20 to 29 age range. But then following that large increase in cases in the 20 to 29-year-old age range, what we've seen is now transmission that's occurring to other age groups in our community. We think that there's some reasons that the 20 to 29-year-old age range saw those increases. I think a perception that they're not as vulnerable to COVID-19 and willing to make decisions that aren't as careful for protecting from the spread of disease. But we know that they don't then live in a bubble, just that group. And because of the increase in the disease in that group, then now we're seeing increasing cases that are occurring in the 30 through 59 year age range, pretty significant increases in cases there. So it's that community transmission and spread. And we need to decide what we want for our community. Do we want to continue to have our schools open? Do we want to continue to have our businesses open? And if the answer is yes, then we all need to be part of the solution of preventing the spread of COVID-19 with the personal actions that we take. If it's not important to us to have the schools open, to have our businesses, workplaces, economy open, then we can slack off and ignore the precautions that have been recommended. And that will put us in a situation that potentially we need to start closing things down again.
Hi, Kevin. Shoditi from This Is Reno. You mentioned that the spread is happening throughout the community. So could you please break it down for lay people? What exactly does it mean and how they should take care of themselves, what they should be aware of? You mentioned that they should be socializing with the immediate family, but apart from that, just to give a sense of the danger, how should we communicate to the common people?
So just to give a sense of the danger, we have people that have tested positive for COVID-19, and they have been close contacts of numerous other COVID-19 cases, not because they were all together at a gathering and that's where it spread and that's why they were in contact with numerous cases, but because they had contacts with other cases from various social interactions that they had, having dinner with somebody, being a member of a household with somebody, being in a class with somebody, so that we can't really even attribute where that spread occurred. So people need to be aware that there could be multiple people that you encounter during the day that may have COVID-19. They may have not developed symptoms yet and get tested and are determined to be positive later and identified that it was during their infectious period. Or they could be people that are fairly asymptomatic and never go in to get tested. So it's out there, and that's why I'm recommending that if you can contain your interactions, and that's why I'm saying your immediate household members, because that's like the bubble that people can have of their household, and then try to limit those other interactions to only the things that are necessary for you to do until we can get to much lower levels of COVID transmission in the community.
Just one more question. So you briefly mentioned that there might be a potential of closing things down. Can you please elaborate on that?
Well, what we've seen across the world is with the resurgence of new cases that are happening, There are rollbacks of the gradual reopenings that have occurred. So, you know, we've in Europe, it's been in the news of curfews, of closing of bars and restaurants, those types of things. So, you know, that we don't want to be in a situation where we're going back to what things were in April when and late March when we were closing everything down. We need people to really be engaged in this fight against COVID-19 if we're going to be successful to keep the economy open.
But there is a potential.
Yes, there is.
Okay, thank you.
Based on, Kevin, this is Siobhan again, based on the community spread, and I think we had talked about this when school started, how many kids might be walking into school with COVID. What would be your estimate in a typical school? Do you think like there's 20% of kids maybe are carrying the virus and don't know? What would be your estimate of what a typical school would have in terms of COVID cases based on everything you know?
I don't have a good estimate to give you off the top of my head, Siobhan. I think it would be looking at the active cases that are in the school system, and recognizing that when we did our seroprevalence study of, you know, how many people had developed the antibodies to COVID-19 back in June, we found that it was about 4.5 to 5 times the number of people that had tested positive had those antibodies. So when you look at the number of active cases, I think it's safe to presume that we've got probably at least 4.5 to 5 times that number of cases that are occurring that just haven't been tested for COVID-19.
Based on the community spread right now, would you still want to see schools go to distance learning? Would you want to see the school district go to a distance learning model?
That's a tough question to answer, because with the level of community spread that we have going on, if they're distance learning and they're not in the rest of their lives practicing those proper precautions, then we're going to continue to see spread happening with those students and their families in that distance learning environment as well.
Any other questions for Kevin Dick? Okay, hearing none. Like we always do, this is recorded, so it'll be on the COVID-19 Washoe.com website here in the next hour or so under press and press conferences. If you have any other questions, feel free to reach out to me, and thank you all for being here, and thank you for your time.